Hello, everyone. Welcome to the Aesthetic Mentor. Saturday night, well, really Tuesday Night Live. We stole that from Saturday Night Live. Going to have a very special guest appearance tonight by Courtney Blanchard. And the reason I chose Courtney was because, there's so many different pathways to success in this industry. Hey, Wendy. Long time no see. Hello, Eileen. IV infusions. You're going to like this because we have a lot of IV therapy stuff tonight. And the reason I chose Courtney was because there are so many paths to success, right? There's lots of ways of making it in this industry. And our special guest tonight went a different way and became very successful. And I want just to have her relate her story to you with respect to what she did, what she saw, what she's doing now, how her path has changed, and how things have affected her. Hello. Before we start, I just want to mention that we are the Aesthetic Mentor. I'm Dr. Russo, the Aesthetic Mentor. And if you want to click on the link in our bio, you can see all of our course offerings. You can have us mentor you. You can work with us. You can come to our school. You can inject cadaver heads and cut them open with us and have all kinds of fun. And speaking of that, hello, Saitan, New England. We did have... Hey, Carmel, you're a little late.
1 minute.
You're a little late, 7:01. Come on, get on your game. We did have another occlusion that I saw yesterday. Because once we start talking about anatomy, I start thinking about how important it is. Hello, Brittany. We're going to talk about that occlusion just for a minute that we saw yesterday. Right here. Patient got injected a couple days before, like on a Wednesday, and started having some discomfort, didn't call the provider. Hello, Eileen. I was just watching the videos of the chin and jawline class. What did you think of those? Pretty cool stuff, eh? And she really didn't come in and see her provider until 2 days later, and she had sort of this wedge-shaped area here that was very worrisome. Delayed capillary refill, subjective sense of pain, hyperemia, hypoperfusion, all kinds of stuff. Love it as always. Well, we love you too, and thank you for being such a loyal friend, patient, customer, and student. Because really, it's all about being a student. It's all about learning. I try to learn something every single day, and I think I do. It's very humbling. It's a very humbling field, and I'm talking about an occlusion that we saw the other day. I guess it was yesterday. That was done by, very experienced injector, probably over 10 years of injecting. Very good, not really having many problems. Hello, Katrina. My God, the cat's back. Right here. And so, trying to figure it out. And she got treated with hyaluronidase the first day. And then I saw her like 4 or 5 days later. And they treated her again before I saw her. And, it was difficult, because she's a young girl and she was actually getting treated because she's a model, and she was flying out to California for a photo shoot in a couple weeks, and she just wanted her lips to look a little better, and now they're not. So, at that point, capillary refill was better. She started having a little bit of epidermal loss already, and she's going to have some loss. It's not a full thickness loss. It's going to be okay. You can salvage delayed occlusion treatments, but, obviously the sooner you get to them, the better. And, people were saying, well, why is it going up this way? Well, if you know your anatomy, you know that the superior labial arteries, which come off the facial artery, send these columellar branches directly up to the nose. This is the columellar, right? So the columellar branches go up this way. So if you're doing one of these kind of crazy injecting patterns where you're going this way, where you're going like in the path of the artery or in the same, parallel with the artery, and you get a little deep here, whether you're doing Cupid's bows, filtral columns, or trying to do something funny at the edge of the lip. Those vessels are so incredibly close to the surface, and they're so easy to cannulate, and it happened, right? So it's always disturbing to see these patients, but basically my only role was to say, you know what? It's going to be okay. It's going to heal. It's going to take time. I don't think there's going to be any permanent tissue loss. I don't think there's going to be any scarring, but you know what? It's going to be a few weeks of really difficult times, right, for that patient. So I just wanted to mention that because, again, if you haven't taken cadaver, please do. If you don't really have a great understanding of anatomy, please get it. You just can't know too much anatomy. And even when you know anatomy, the vessels aren't always where you think they are, right? So part of it is just knowing which level not to be in, and we stress that again. And we always err on the side of being conservative and being safe, because, you know, if you've done 999 injections and your 1,000th injection is a bad one, where you've got an occlusion or a visual loss or something like that, you know, when there was an old saying on Wall Street, you're only as good as your last trade. Well, in this business, you're only as good as your last injection. And if you have a terrible result, you know, it's going to be hard for you to live that down. It's going to be hard for the patient to deal with that. And it's just, you know, makes everybody awful. I mean, I don't want to talk about that anymore, because enough about that. It's depressing. We have some really interesting stuff. Did Courtney join yet? Courtney Blanchard is going to join us shortly. She is a nurse, an RN, and I'll have her tell you her story. But she was working at Children's Hospital. Maybe we can we text her? Do you have her text? I can't use my phone. But we found her, you know, she came to us to learn, and she was fully employed at a hospital. Oh yeah, you know, Julie will know. Mm-hmm. She was fully employed at a hospital and at Children's Hospital, and then she went on this interesting. Oh, here she is. Here she is. Go live with Eileen. Where are you, Ivy League?
Where?
Come back. Try again. Okay.
Oh, there
you are. All right, we got her. Hey, Courtney, how are you? Can you hear us? Okay.
Yep, I can hear you.
Great. I was just giving a big lead up to you. But I was basically saying that I chose you tonight because I thought that it's interesting to see how people go on different paths and end up in a successful place. And your path was a little different than most. And I really admire you for that. And I want you to sort of share with our audience a little bit, first of all, just a little bit about yourself, and then we'll kind of go into some specifics about what you do and how you do it and why you do it and what IV Hydration has done for you. So Courtney Blanchard, RN, please begin.
All right. Hi, everybody. So I am the owner of Ivy League. I started my journey about 5.5 years ago under Dr. Russo. I was a nurse actually at Children's Hospital for 17 years and decided to take some Botox classes on the side, and then that led to filler classes, and went to houses for Botox, started with friends and family, and then just it took off, and I called it Return to Youth.
Yeah.
That was my first business name, and I really enjoyed the Botox and the fillers, and decided to actually do the IV treatments at other people's houses too. So my first endeavor was going to Nantucket. Actually, I bought 100 IV bags and took it to Nantucket for Fibromyalgia weekend.
Can you tell us what Fibromyalgia means?
Yeah, so Fibromyalgia is a sailing regatta. It's every Memorial Day, and it's a lot of young kids that rent houses over there, and a lot of drinking going on. So the first night we kind of went out with the public and gave koozies out with the 1-800 number on it, and we actually trademarked hungover ? So we had hungover ? On our shirts, and gave out these little bands that had the hungover ? And the 1-800 number. And then the next day, the phone just kept on ringing off the hook, and that was it.
How many people do you think you treated that first day?
At least 25. I took over IV bags, and I ran out of it. So yeah, I ran out of them in 4 days over there.
Someone jumped to the punchline. Like, how did they come up with the term Fibromyalgia?
Really, maybe actually Fibromyalgia was made up by a sailor. I think it was where the Fibromyalgia,
right. They were lost. They were like, where the Fibromyalgia? Yes. So interestingly, you started out in the concierge model, which is kind of one of the models we talk about at our school, where you are delivering services to different patients in their homes. And you and I were kind of doing similar things. I was running a company called IV Docs,
yep,
which is kind of the same idea as what you've become as IV League.
Yep.
And that I know you started children's and took courses. How long were you doing? How long were you studying and doing fillers and neurotoxin before you said, you know what, I'm quitting my day job and I'm going all in on this?
It was about only like 8 months. I really went all in. I knew
Wow.
that.
Yeah.
Kind of had Botox in the back of my mind for actually 10 years, into my nursing. I knew I always wanted to do something in the aesthetic world. So when I did it, I was kind of all in. So
Yeah.
yeah, and then
I remember seeing you and telling you that I thought you were going to be successful, and that I sensed that you were going to, put it all in the middle. And I told you, I think that people who do that tend to be the more successful nurses and clinicians.
Class like yesterday when you were like, raise your hand if you've quit your day job, and I was the only one that did.
And you're probably the only one out of that class that's become so successful.
Yeah, so I was all in, and it's been quite a ride. I now have 14 nurses underneath me.
Wow.
Second store in Salem, New Hampshire, and I have a great staff. Most of the nurses are ER and IV certified, of course, but they're super, and I'm so lucky to have such a great staff. But yeah, so we have Ivy League actually came to me in the middle of the night, that name. I had been pondering over it for a while, and I woke up and I was like, oh my gosh, Ivy League, that's the name of it.
So I know IV therapy is the majority of your business. We'll talk about like what kind of what kind of additives you put into your IVs, what makes sense. What do you like best? Is it for hangovers? Is it for COVID? Is it for general health and wellness? But what other services do you offer? I know you're going to be doing cool sculpting soon because we're working together on that. But what other services do you offer your IV patients?
So I do Botox, fillers, chemical peels, dermaplaning. We have the M-Sculpt machine, that body contouring machine that's equivalent to 20,000 sit-ups in a 30-minute session. And actually, that was a great thing to add to my list, because it was a set it and forget it kind of machine. So we have one treatment room in our lounge in South Boston, and so it was kind of nice. Like it's you put it on the stomach or the butt, and then you can walk away for 30 minutes and do the IVs in the same time. So it's been very successful at Ivy League, that M-Sculpt machine.
And you're going to have the same results with Cool Sculpting. It's the same thing, and you're going to combine the two of those. You're going to have amazing patient results.
Doing a package.
So tell us a little bit more about the IV itself. What kind of people are coming to you? What are they looking for? Is everybody just drunk and hungover? Tell us a little bit about the type of patients that you see and what that looks like.
In South Boston, we kind of led with the hungover crowd because, there is a bar on every corner in Southie and professional that are out. But I would have to say that 70% of the people that come into Ivy League are health and wellness, and especially with COVID, people more, take care of themselves now than ever. So we have a very popular drip that we're doing. It's called the Defense Drip, and it's your Myers cocktail that's been around forever. It's got magnesium, high dose vitamin C, calcium, a B complex, and then glutathione, which is my favorite antioxidant. So that is a push, and glutathione is like the mother of all antioxidants.
Good stuff.
And it binds with vitamin C to take out all the bad stuff out of your cells. And, it's really rewarding when you see people, that have, they're changing their lives because of these vitamin drips. We have people that come in for fibromyalgia. We have cancer patients that are kind of in remission that actually Dana-Farber doctors are referring.
Wow, that's impressive.
is cool because high dose vitamin C makes the body more alkaline. So you're not feeding the disease. So it's helping prevent a lot of different things. So
we're talking with Courtney Blanchard from Ivy League in South Boston and New Hampshire. She took a different path to becoming successful in this industry, and I'm just picking her brain about that. Courtney, a lot of people have experienced COVID and similar disorders, and I know there's like this whole post-COVID fatigue and muscle ache and just like I'm not quite all there syndrome. Do you treat those patients, and if so, what do you do to them to make them better?
We do. So magnesium, I've been learning so much about magnesium, and it actually can stop an acute asthma attack. It's really good for stress in the body. And then the combination of the vitamin C and the B complex, it really seems, if you look at our reviews on like Google and Yelp right now, people that have come into us after COVID, really bouncing back a lot faster. So it's really cool. And also just for preventative, people that have had COVID and, they don't want to get it again, or they're just trying to, keep up, boost up their immune system.
So what's the best immune system booster? Is it vitamin C? Is it
high dose vitamin C? Yep. And then zinc is a big one too. Zinc, vitamin C, magnesium. Yeah.
Question for you from one of the audience. Do you recommend it if you're going through chemo?
So not as you are going through chemo, but if you are in remission, if you're, that's when we get the referrals. You can do straight hydration. Actually, a close friend of mine told me that while they were going through chemo, the hydration itself was a changer. Yeah.
What's your defense drip?
So that is the Myers cocktail with the glutathione.
I see.
We have, I feel as I branded the bags pretty well. We have 5 different drips. The first one's the rookie. It's just straight hydration. The game changer is like a multivitamin drip. So what you would get in your regular multivitamin, but you're getting it 100% into your bloodstream. So you're getting 100% of the effects from it. And then we have the knockout drip that is high dose vitamin C, your multivitamin, and then a glutathione push. We like to call that the knockout because it knocks out a cold or flu, but it also makes you look like a knockout because glutathione actually is really amazing for your skin. It 12 to 24 hours, your skin starts to have a nice glow to it. So it's good before like a wedding or, if you're doing something important. So I find I look a little bit younger the next day. It's weird when you take glutathione. It's good for pigmentation, that kind of thing. So
how long did it take you? Because I'm sure people are thinking, you started at Children's, you worked there for 17 years. You started taking these courses on the side in our school, neurotoxins, fillers, all this sort of stuff. And then after like 7 or 8 months, you said, I'm going all in on this. I'm quitting my day job and I'm going to start doing this and I'm going to add, IV therapy. How long was it from that point when you said, I'm going all in, before you became, I don't know what you consider successful, but when you thought to yourself, you know what? This is the right decision. I've made it. I'm making some good money. I'm building a business. Like, how long did that take?
I would say it's about 2 years, all like from when I started with you, when I actually had the brick and mortar in Southie, about 2 years. And the South Boston location has been open for 3 years.
Mm-hmm.
Yeah.
Someone asked, did you take IV hydration courses to get started?
So I was on the IV team at Children's.
Yeah.
So that was my niche. I was always called for the hardest kids at Children's Hospital.
Oh, wow. That's amazing.
For 7 years and was just, I don't know, it's always been like a calling of mine doing the IVs. So.
Well, I have a question for you. I'm going to put you on the spot, so get ready. By popular demand, I've been asked to ask you if you would be willing to teach IV hydration courses at my school.
Absolutely.
You would do that?
Absolutely.
Okay.
Of
So
course.
for all of you that are asking, she's going to become a faculty member at the Aesthetic Mentor, and she's going to teach us all about starting IVs, which, like Maddie was asking about, who just graduated nursing school, because they don't teach IVs in nursing school anymore, or even Foley catheters or anything, Courtney. They don't.
Of the IV that you
But we
provide.
want you to come and be our faculty member and teach everybody about all this, all the glutathione, all the magnesium, and the vitamin C stuff. That's so important, and I think a lot of people will be interested in doing this.
Absolutely. Absolutely.
You guys heard it live. She committed to doing it. We got you on this one.
Yep. All right.
I'm a NICU nurse. I love placing IVs. There's a place in heaven for you guys. That's amazing. I mean, really, that's God's work. I can't even believe it. We've already got people trying to sign up for your course.
All right. Awesome.
So what about branding? How hard is it to brand? Like, what do you do to increase your branding and, increase your marketing?
So I actually, for my logo, I used 99 designs. I didn't have much money when I started this, this endeavor. So I looked for some shortcuts and, trying to market and trying to, build the company. And I recommend 99 designs to anybody. It's actually sign up, you tell them what you are looking for, which my logo, I told them I wanted it like a Harvard crest, but I also wanted it to look like an IV bag, and put it together in only a few days with only $99, I got that logo, which was great. So
wow, that's impressive.
Yeah. Yep. So we've done some marketing. I do a lot of Instagram, Facebook, but at first we were really hitting the streets and kind of going out to the bars and the restaurants and giving out the koozies, giving out our menus. Word of mouth is the biggest thing with us too. And our website company has been great with the SEO. I truly believe in SEO because we are the first on the list when you look at, when you Google IV hydration, we pop right up. So yeah,
it's so important. Yeah,
very important. We've done some commercials. I've had a billboard up in Boston that says,
"Did you?
Mark, let us help." Yeah. So that did well. Yeah, it's pretty cool. We have, and this, it takes you into some exclusive places. Like I've done NFL players and comedians and been backstage at concerts doing, these, it's really cool. I can't name names, but it's been pretty.
So for your average patients, your repeat customers, how often are they coming back to see you, and what kind of drips are they getting?
So I have my regular clients. Some of them come in every week.
Wow.
Most people come in every month, and then as needed. But we have the return rate is about 65%.
That's phenomenal.
Yeah, it is.
That's really, really high for any procedure. I mean, honestly.
Yeah.
So what's your price range from your lowest price, like there's nothing in this bag except saline, to like I've got everything I have in my shop in this bag?
Yep. So our regular, just standard IV bag is $80. And then our priciest one is $260. And I feel like that everything that we do, we keep it a very fair price compared to other parts of the country. I like to make it mainstream so anybody can come in for an IV bag. And then, we do the B12 shots and the lipo shots. So that is like a revolving door of B12 shots. Love it. You know, it's just a $25 per a shot, and it's easy. So, and it really does make a difference for people that are deficient.
That's really impressive. I'm shocked at the number of 65% return, but that, I think part of it is keeping the price at a reasonable point where you're like, you know, we talked last week about patient retention, and it's so much more efficient to keep your patient than to constantly try to get new patients, right? To keep those patients who are loyal customers, keep them loyal. They're built in like almost like an annuity for you.
Yep.
And you can sell them other things like, hey, have you tried Botox? Have you tried filler? Have you tried Emsculpt? Have you done a peel? Whatever it is. I mean, you've got them. They trust you. They're loyal to you. And it's so much easier to scale a business when you treat them well, make them happy, give them a little extra here and there. And that's really what builds your business. Do you agree?
Oh, absolutely. Customer service, being good to your regular customers. That's what we're all about. We'll give free treatments here and there to our customers that, definitely deserve it and come in all the time. So, yeah. We
found that little extra sometimes is really appreciated because patients generally don't expect that from a provider, and if you're like, you know what, this one's on me, or this one's 50% off, or whatever it is, you're still making money on it. But it's a little bit of goodwill that goes a long, long way to creating loyalty. And then they tell their friends and their friends, and you're off to the races.
Yep, exactly. And a B12 shot is always a good way to just give, a little bit of a...
Oh, yeah. Because it doesn't cost you much of anything. Do you draw labs with most of these, or just a Myers cocktail? Question mark.
Yes, we do not draw labs. Most of the vitamins are water soluble, so you excrete it out naturally. So there is no need to draw labs with what we are giving.
So when we were doing IV docs, we were making house calls to people that were like not feeling good. Do people come in when they feel like they're starting to get sick and they're just like, I'm not feeling great. Can you boost me? Do people come in for that?
Yep, absolutely. And it's cool when people that, sometimes get chronically sick and they feel like they're coming on to something. Big one is fibromyalgia. It helps them so much. We actually get a lot of POTS too. They dehydrate very easily. So they come in when they start feeling really dehydrated, and it turns them right around. You can actually see them change right in the chair in that 40 minutes. So.
Yes, there's nothing better than rehydrating someone who's not hydrated. It just makes them feel better, like within minutes, as you say. Live Fitness is asking, does this help with COVID symptoms? And I think you already addressed that, but maybe for the people who joined late, you could just discuss what you've done with the COVID patients.
Sure, absolutely. Yep, and then our Hail Mary drip, which is it's the hangover drip. So that's the Zofran, which is an anti-nausea medicine, and then Toradol, which is an anti-inflammatory. The same family. And so if you have a headache, if you're nauseous, and then we mix it with a multivitamin to give you some energy too. That's our hangover drip. And also if you have a stomach bug or have a headache, a lot of people that come in for migraines, they love it because they usually go into the hospital, but we have the same cocktail that we would give in the ER, which is pretty cool.
Courtney, knowing what you know now, what would you have done differently to get started and become more famous faster?
Oh dear, I don't know. I've been hustling since day one.
I know you're like the hardest working girl in show business. I think you're amazing. But is there any way that we could have helped, that we could have helped you cut to the chase faster? Is there anything you did that you said, oh, I wish I hadn't wasted my money on that, or I wish I had done this faster, or anything like that? Or are you pretty much like, I've done it the way I think it was right, and there's really no other way that I would have done it?
Much for some marketing, that kind of thing, that didn't do anything, that kind of thing. But all in all, I don't know. I feel like it's been quite a ride, and now, so my fiance has been such a support too. Scott, he's amazing. So he's like the manager now, and he takes care of all the finance stuff, and so that takes that plate, which is
Fantastic. Fantastic. Someone wants to know, what cocktail do you give for migraines?
So yeah, you can give the Zofran and the Toradol, and then whether so it's kind of dependent on your weight, but sometimes people come in for 2 liters of normal saline with it. So
It's really hydrated. Scott is amazing as well. A great duo. Must be one of your loyal clients.
that's Jamie. That's the ZO girl.
Oh, Jamie.
That's Jamie. She's awesome. She comes in for IVs a lot, actually.
Fantastic. Well, I want just to tell you that we're very proud of you, and you know, you've really done an amazing job in a short period of time, and it just shows that when you're determined and hardworking and go all in, you generally become successful. So now that you've got to where you are, what's the next step for you? What are your goals? Where are you headed?
So well, I'm hoping that we can franchise this at some point. I want to pop more up. That's my goal. I know everybody can benefit from it, and I'd love these on more in Massachusetts, more in New Hampshire, maybe Rhode Island or Connecticut.
Sure.
In this area, not too far, so I can't manage it. But would love to have more nurses be able to have the opportunity to work in these
Yeah, you've got 14 nurses working with you now, right?
Yes.
That's I mean, I think when you first started, I remember you were like doing every IV and you were putting in every patient. I'm like, you can't, this isn't sustainable. Like, you need to clone yourself and take time off and like refresh and think about building, and you obviously did. Yeah. But that took a little bit of time too.
Yep, exactly. It's, it was head down for a while, but now I feel like I'm kind of looking up, and I'm able to, do what I really want to do with this business. So it's cool.
Laura loves working for you. And someone asked, do you use Myers cocktail for post-op patients?
You can use any kind of IV for post-op patients, but yeah, that's, the electrolytes, everything is great for post-op patients. Yep. Yep.
Well, I don't want to hold you up all night, but I wanted to thank you for joining us. If anyone has any other questions, ask now. Jill says you're a rock star. All good. Boy, you've got a really loyal base of people who love you. This is incredibly good to see. But anyway, this is Courtney Blanchard, Ivy League. She's in South Boston and New Hampshire. Follow her if you don't already. She knows probably more about IVs than anybody I know. And she's going to, today, IG said she's going to teach a class at our school in Waltham. We're going to help set her up with that. And I'm sure it'll be sold out the minute we post it. So I'm really looking forward to working with you again and doing even better things.
All right. Awesome. Thank you so much.
Thank you, Courtney. We'll talk soon. Appreciate it.
Great. Take care. Bye-bye.
Good night, everybody.